Plantar fasciitis is a common heel pain that presents with inflammation and pain in the heel at a level that stops them from doing things that are important to them. And that's oftentimes when people need to come in for care. So oftentimes this occurs when someone has tightness in their plantar fascia, or specifically when they lack great toe extension. So that plantar fascia band, it begins in your heel, it comes all the way down towards your toes, and a big portion of it actually goes towards your big toe. So if your big toe becomes stiff and it lacks the available range of motion that it needs for walking or for functional movement, then this fascia becomes taut, it becomes tight, and it becomes painful. This is oftentimes what leads to that first step in the morning pain. So for most people, that's kind of the hallmark sign that brings them in for care. One of the best things you can do if you're experiencing this pain is to do a stretch before you ever get out of bed in the morning. So keep a towel by your bed and do a stretch, holding about 30 seconds to 60 seconds, and repeat that 2 to 4 times. If that doesn't improve your pain, you also should probably do some calf stretching. So oftentimes we focus on just the heel itself or the bottom of the foot when it comes to plantar fasciitis. But those fascial bands and that connective tissue is really closely intertwined with the Achilles. So if you're not stretching your calf, and you're specifically not stretching both of the muscles of your calf, then you're probably not fully addressing this soft tissue. In addition to stretching techniques, some other things you might want to address include strengthening the muscles on the bottom of your feet. So you're going to try to keep equal pressure on your big toe, on your little toe, on your pinky toe, and on your heel. And while doing that, try to squeeze the arch of your foot and lift your arch off the ground. This is going to provide stability along the arch of your foot and not put the entire load on your plantar fascia or on that fascial tissue to support your arch. Some additional things you might want to consider could be addressing your footwear. So oftentimes there's biomechanical reasons for this occurring. So people who pronate, for example, and their arch collapses in are at a greater risk for loading this tissue and causing inflammation. So if you're one of those people, make sure that you're in a good supportive shoe, or maybe try an over-the-counter insert first. And oftentimes people think that if their heel hurts, they need to be in this super cushy, soft shoe, but that actually might be causing your problem to get worse by going in this nice, comfortable, soft shoe. So being in a good supportive shoe is important. And if you have questions about what that should look like, come in for an evaluation. We have physical therapists who are trained in doing biomechanical evaluations to look at your gait mechanics and give you guidance in terms of orthotics, and maybe an over-the-counter is not enough. So you might actually need a custom device, and we have specialized therapists who can provide that biomechanical evaluation and give you recommendations on orthotics and shoe wear. And again, if that alone is not enough, we also offer a special modality here at Physical Therapy at St. Luke's called extracorporeal shockwave therapy. And the evidence is clear that within 3 to 5 sessions of introducing this, we can significantly reduce inflammation and pain and ultimately improve outcomes and get patients back to doing what they want to do.